strong.
Oh, hi, and welcome to Funny Minds. I'm Lynn B.
And I'm your co-guru, Edward Beth.
And today I have the privilege of introducing my lovely youngest daughter, Kacey Leigh Grosso. Hi, Kacey. How are you?
I'm good. How are you guys?
We're very good. Kacey's in the medical profession, and we have her on today because she went through a very interesting adventure, one that, I'm sure a lot of women have taken this step. Maybe a lot of women are in fear of it, maybe don't know enough about it, or, want to know more about it. So Kacey went through IVF, and that's, what is it?
Vitro, right?
Vitro.
Am I allowed to talk? I didn't know.
Yeah, go ahead. You can talk. In vitro fertilization.
Yep, exactly. It's a very, I can't even describe it in words. It's such a roller coaster of a process, mentally, physically, emotionally. First off, not everybody needs to go through IVF. A lot of women are lucky enough where, first time they try and have a baby, they're one and done. They don't have to go through months of ovulation tracking and, having tests done just to see if IVF is a route that they need to go. When it happened to me, this was back in 2016, I was diagnosed with hypothyroid. So your thyroid has a lot to do with your fertility, your thyroid, your hormones in general. So when I was diagnosed with hypothyroid and I got it back on track, I thought I was going to be fine, moving forward and trying to have kids and whatnot. But then when I got married to my ex in 2017, I found out that my hormones were way off where they were supposed to be. I remember, Mom, I don't know if you remember, the week leading into when we had gotten married, I was supposed to get my period that week and it never came. And I just figured that, because of the stress and the excitement, the anxiety, all this stuff, it just threw my cycle off track. So got married and then we went on our honeymoon. What was it? Maybe 2 weeks later, still didn't have my period. I wasn't getting positive pregnancy tests. I didn't have any symptoms like I was going to get it. And finally, when we got back from the honeymoon, that's when I went to the doctor. They did all those hormone tests on me and my prolactin levels were through the roof, which prolactin is elevated when you're breastfeeding. So they were asking me, do you have discharge coming from your nipples? I'm like, no, there's nothing coming out of here. Oh,
That's it. Well, bad.
Yeah, right? Bad scenario.
So literally they had to put me on a pill to jumpstart my period. And then they were monitoring me for, I don't know, maybe a couple of months or so, just to make sure everything was normal. My thyroid, my progesterone, all of that stuff. And it was normal, but I still, with trying, wasn't getting pregnant. So that's when my doctors had told me, I think you should at least go talk to a fertility specialist just to, let them know what's going on. And in the event, while you're doing that, maybe you'll get pregnant, but at least if it doesn't happen, then you have them to fall back on, which is what I ended up doing. I started out with, and I don't remember his name. I started out with an infertility specialist.
Wasn't he?
No. He was the second one.
Oh, okay.
So the first one that I went to was an infertility specialist in Englewood. So
new name.
Because of that, I don't remember his name.
Okay.
Am I not? If I remember, am I allowed to say it or no?
I wouldn't.
Okay. All right. So, all right, that's fine. So,
call him Dr. Feelgood.
Yeah, feel good. Or you're going to give your information at the end. People can contact you if they'd like to get more information.
There you
Perfect.
go.
So I went to him in Englewood, New Jersey, and basically because of my age, and he basically told me that he didn't want me to just go straight into IVF. He wanted to try other routes too. So you have, you can do timed intercourse, which basically they just monitor your ovulation cycle. And then you're literally going to the doctor's office every morning between 6 and 7 a.m. for monitoring.
I remember you doing that, but okay.
Because I hadn't told anybody yet. Nobody knew about this yet. Yeah, I kept it to myself because I was embarrassed. The thing about all of this is in the very beginning, when you're trying to come to terms, I should say, with all of this, is it's embarrassing because you don't feel like a woman because you're having issues with what a woman should be able to do, conceive.
Mm-hmm.
So it was very, very hush-hush in the beginning. So we did timed intercourse a few times. So again, he's monitoring my ovulation cycle, going in every morning between 6 and 7 a.m., doing vaginal ultrasounds to check my ovaries and check the follicles that are growing before I ovulate. And then once he sees that there's a follicle that's the best size or whatever, then he would give me a hormone injection to take. And then that would basically make that follicle release. So then I would ovulate. I would ovulate that night. So then that night you would have intercourse. And then you're hoping for the best.
Oh, so romantic.
I know.
I mean, let me get out the needles instead of the candles.
I know. And it does, like, it really takes the fun out of, trying to make a baby because now you have to follow doctor's orders.
Fun out of all of it.
Guys, and it's like, all right, you got to get your ass home. We got to get into bed. We got to do the thing. And it's like, there's no spontaneity to it,
Yeah.
So,
yeah, but at least all you have to do really is crank Barry White louder.
Oh my God. I don't like him, so no. I don't like him. I'll play some Post Malone.
She's a T-Swift girl.
I am a T. Yes. Shout out to my lover. So we did that a bunch of times. And I mean, unfortunately, it didn't work. And at the same time, it took a toll on the finances because it wasn't covered through insurance. So I had to take a step back. I couldn't do that anymore. I just couldn't afford it. It was too much money between the medications, the lab work, the vaginal ultrasounds, the office visit. It was way too expensive. But I found out at the time when I decided to take a step back that New Jersey has a mandate that if you're in a company that has over, I think at the time it was 100 employees, you have to include infertility benefits on your company's insurance plan. Okay. So that's when I checked my ex-husband's insurance plan and I saw that it was covered. So I immediately told him, I said, we're going to put me on this plan. And then I'm going to look around and, in the area, see other specialists and who's in network, and we'll go from there. So I got on his plan and I went to a fertility clinic in Hazard Heights.
Mm-hmm.
I would love to say the doctor's name because he's amazing and I love him, but that's okay. So I went to see said doctor and he had told me, he's like, listen, he said, if we're going to do IVF, he's like, you have to go through certain processes first. For insurance to cover it, you have to have so many failed attempts at other things. So I told him I had already had, I think it was 3 at this point. We did 3 timed intercourse attempts that failed. So he said, this is great. He's like, now we're going to move on to IUI, which is intrauterine insemination. So what that means is I am again injecting medication into my system to grow my follicles. So at the same time, they have to get a sperm sample from the partner, which they did. And what they're going to do is they're going to weed out all of the bad sperm and just hold on to the good sperm. So now when my follicles are big and they're ready, again, I got to take that trigger injection. I go into the office and now they have all the good sperm in a syringe. And now this is when like all of this stuff just becomes like super, super vulnerable for you. So you're in a room and it's like you're at the gynecologist. You're on your back. your legs are.
Well, I was with you. I was with you for that when you had that done.
No. That was for. I'll get to that. Don't worry. You weren't there yet.
All right.
So when I did the IUI, like, you're laying down, feet are in the stirrups. You have the doctor literally in front of you, opening you up. And then you have nurses in the room as well, because everybody's got to do their part. So, I mean, am I allowed to say vagina?
Yeah.
Yeah. Okay. So your vagina is on display for everybody to see. Perfect. I don't have one of those. I'm not going to say that right now.
I'll say it with you. Vagina.
Vagina.
So your vagina is on display for everybody in this room. And it's uncomfortable because I'm thinking in the back of my head, did I shave good enough? Like, is there something that they're seeing that I missed? Or like, do I have to
You didn't do a Brazilian before you went?
No, that was the last thing on my mind. So the doctor, he puts in the speculum, opens you up, and then they insert, it's like a syringe with all the good sperm. They insert it all the way into the uterus.
The turkey baster.
It's the turkey baster. Exactly. That's pretty much it.
And your brother's dying.
I love you, Eddie. Just remember, I give good blowjobs.
Oh, you
too.
are a turkey, so I mean.
So they, they push the good sperm into the uterus, because at the same time those follicles are coming out of the ovaries. So now they're hoping that everybody's going to meet in the middle, and a baby is going to be made.
Yeah, they're going to.
I did that,
and
I must have done that. I don't know. I think it was 3 or 4 times. Mm-hmm. Nothing. I didn't have a chemical pregnancy. Like, nothing happened from that. Like, I had said to this doctor, it's like my body doesn't know what to do when it sees sperm. Like, it kind of just runs away. Like, I don't understand what's going on. Why?
I don't even know how hard it is right now for me not to comment on any of this.
You can say what you want to say.
No, it's just you are basically writing a comedy skit for me right now.
Great.
I'm trying to retain it all. So
just make sure you give me some of your money.
Now, children, it's
good off of that.
To be educational.
Yes, listen, it's very educational. I promise you. So Eddie, behave. So I don't know. I failed at that 3 or 4 times, and it was back to the drawing board. But at this point, you only had one step left. You had to go with IVF. Mm-hmm. So let me tell you something. IVF is not for the faint of heart. Like, it is very, very uncomfortable. It's painful. When I tell you pain, like, you can't even sit down in a chair. So what you do is you have to stimulate as many follicles in both ovaries at once. So over the course of, I want to say it was like 2.5 weeks, I'm injecting hormones that are growing multiple follicles. So instead of, me just growing the one that would ovulate during my cycle, I was growing up to 30 total.
So you had an army going on in there.
I had an army. And not only that, my ovaries literally went from like this to this. And that's what I had to walk around with. And it was very uncomfortable. And like, you go to these classes, like, you have to take classes, you have to take tests before you're allowed to start IVF, because they need you to understand how it is dangerous. It can be very dangerous. Uh-huh. So one of the things was, like, I wasn't even allowed to like turn a certain way, because when your ovaries get big enough, they can twist and it can cut off the blood supply to your uterus. So yeah, it's called ovarian torsion.
Wow.
Yeah. So your ovaries,
fertile torsion. It's ovary
exactly.
Torsion.
There you go.
So it's ovarian.
So I ended up going through IVF. I think it was like maybe mid or late 2018. And actually, no, it was mid, because it was my birthday. I was taken out. My ex took me out for dinner. And I remember he took me to a restaurant when we were sitting outside, because it was beautiful out. And the seat that I was going to be sat in as soon as I sat down, like I just felt like all the pressure from, my pelvic region just coming up, and we had to go. Like I was so uncomfortable. I couldn't even go out to dinner. So
there's nothing you could even do about that.
There's nothing you can do about it, because it's the medication. It's stimulating all these follicles and they're growing, but that's what you want it to do. So it's like a catch-22.
Yeah.
So you're going to the doctor literally every day. You're doing blood work. You're doing vaginal ultrasounds, because they have to keep count of how many follicles they see. They have to measure every follicle. So it's very tedious. It's very time consuming, and you're constantly at the goddamn doctor. So once you get all the follicles to the size that the doctor is happy with, then again, you're taking this trigger shot. The trigger shot is the final process in maturation before they take the follicles out of you. So what that is like with the egg retrieval, that's what this is called. It's called the egg retrieval. So again, you're in an OR. It's an outpatient procedure, but you're in an OR. And again, your feet are in the stirrups. You're spread eagle to anesthesiologists, nurses, there's physician's assistants, like there's the residents, like everybody's in there just honing in on your vagina. And thank God you are knocked out for this. Like I got knocked out, and I remember because I went through 2 egg retrievals. The first egg retrieval, I woke up and I was crying because I was dreaming that I was a fish, and I wanted to stay a fish. I remember crying.
Okay, Mr. Cheezel.
So anyway, I mean, my first egg retrieval, it wasn't successful. I had a lot of follicles that grew. It was up to 30, but they ended up taking out, I think it was maybe 10. And when they tell you the number, you think it's great. You automatically think you're going to have 10 embryos. That's not how it works. Even if you have 30 plus follicles, they might only get 2 out of those.
Oh, wow.
Because what they do from there is, once they remove the follicle, it immediately goes to the lab, and they're going to take the partner's sperm and they're going to let the 2 join. So that's just regular IVF. They literally just put the follicle and the sperm in a dish, and they let it do its thing, like natural course. Mm-hmm. So this happens over a period of 5 days, that they'll look to see how many of those follicles have fertilized. Now say you got 10 follicles and 8 fertilized. So now your number is 8. So they'll call you I think it was the first day after, to let you know what fertilized. And then after that, it was on day 3. And they'll say, okay, out of the 8, we have 5 that had matured. And the other ones, we had a discard of them. Okay. What they're looking for in these days of growth is the cells that are growing within the embryo. So if there's not a healthy number of cells, or what the cells look like under the microscope, they're discarding them, because there's no way, from what they see. And I mean, they're the ones that, do this on a daily basis. They know what they're looking for and what should look normal, not normal.
Yeah. What you want to implant, what you don't want to implant.
Yeah. What's going to evolve and continue to grow and, a baby. So they know what looks good, what doesn't look good. So they're going to discard what's not going to become good. And they're going to keep, obviously, what is continuing to grow and look good. So by day 5 on my first round of IVF, or after my first egg retrieval, out of, I think it was like 10, I only had 2 that made it to day 5. And they weren't graded very well, because they grade them on the amount of the cellular appearance. And then it's also the cells that would turn into the placenta that gets graded as well. And mine were not graded well. So I talked to my doctor about it, and I said, what do you think? He said, let's just try it. Let's go for it. Let's implant the 2 that you have left and see if it happens. Because listen, miracles happen. You can have a shitty graded embryo, and it turns into a healthy baby, you know, in 9-10 months. So it has happened. So he was hoping, you know, it was going to be a miracle. So I had no time in between egg retrieval and the embryo transfer to like kind of just relax and let my body just kind of come off of all the goddamn hormones that I had pumped into it. So when I did, it's called a fresh embryo transfer. It's literally done after day 5, after that last day, them checking on your embryos and how it's growing. You're literally going into the doctor's office that next day. So on day 6, and you're having them implanted. So you have to now take more hormones and more injections because now they need to know that your uterine lining is at the proper thickness, which is optimal for pregnancy. So now I'm injecting what's called progesterone and oil. Progesterone and oil, when I tell you, is the bane of my existence. I still have knots in my ass the stuff is so thick, and you need a huge needle in order to get it out of the syringe. So you have to do it every day until
it hurts thinking of it.
To yourself?
Yes, you have to do it to yourself. Well,
You had to stab yourself in the ass with a giant needle?
Thankfully, my ex did it for me. But
I'm sure he did.
I
And enjoyed every
All right,
second
guys.
of it.
All right.
You're like, no, my ass, not my neck.
Oh my God. So now you have to inject it starting. It was right after the egg retrieval. You're starting these injections, and either you're going to finish when you get a negative pregnancy test, or you're going to finish at 10 weeks pregnant. So I start these injections. My body was exhausted. I mean, it went through hell. So I went through with the fresh embryo transfer, and I did get a positive pregnancy test, but it turned into a chemical pregnancy, which means that usually when you have a chemical pregnancy, it means that there is a chromosomal abnormality with the embryo. So that was very heartbreaking. And I remember calling Mom. Actually, when I got the positive, I had gone to Mom's house and I told her that I was pregnant. And then I remember she didn't know yet about any of this still. She's thinking that, you know, it's natural at the time. And then I remember, I think it was a couple of days later, I ended up calling her when I was at work, because that's when I found out that I had lost the embryo, the baby. And so I called Mom and I let her know. And I remember being so upset because that was my first time like having a positive pregnancy test. And then it was just like, it was ripped away from me. So it's like you go through all these, you go through such, I don't know, like,
emotions.
Again,
It's
it's intense.
Besides all the hormones you're putting in your body, you know, screwing up your body.
From start to finish with IVF, it's all intense, and it's just crazy. That's literally what I tell everybody. It's a roller coaster. There's no other way of saying it. So I took a break from doing anything. I just wanted to kind of like, again, step back, just let my body heal, and then we'll come back to it when we're ready. So I don't know, it was maybe towards the end of 2018. I believe it was towards the end of 2018. We did one more round. And this time my doctor had said, he was like, you know, I want you to start taking CoQ10. CoQ10, they've done testing on it, and it shows that there's some positive like outcome with fertility and boosting like your uterine health and all that stuff. So he told me, he said, I want you to take this for 30 days.
Is it like a supplement?
Yeah, it's a supplement.
Yeah, like a supplement for your uterus. Yeah.
Yeah, pretty much. But actually, I'm pretty sure CoQ10 is mainly for like heart health. But apparently they've done studies. Yeah, they've done studies, and apparently they've had positive, you know, testings with fertility. So he told me, take it for a month and then we'll start another round. So I did. And so I go through it all over again. The injections, the appointments, the blood work, the this, the that. Oh my God. And I ended up with 23 follicles when I went in for the egg retrieval. And when I came out, they had 12 that they pulled from me that were viable that they sent to the lab. Okay, so we're starting off with a positive note. It's 12. It's great. It's better than, the last number. Now let's see, if that number can stay where it is and, we can make some babies out of this. So I ended up with total at the end of day 5, I had 7 embryos. So the first time I did it, I only had 2. The second time I did it, I had 7. So we decided to do a fresh embryo transfer again. Didn't happen. So I just put it on hold again. Didn't want to go through it again. I just wanted to get my mind straight, clear everything and just figure out what the heck I needed to do to make these embryos stick. So I decided, so when that happens, when you have embryos left over, they're automatically frozen. They have to be put in the freezer and they're kept there on ice until you're ready to do what's called a frozen embryo transfer. So when my ex and I decided, what was it? It was May of 20, it was April and it was April of 2019, Mom, right?
Yeah.
Decided to do a frozen embryo transfer. So again, it's the same thing or the same process, but at least your body has that time in between, a retrieval and a transfer to just, get back to normal. So this is the one that Mom went with for the frozen embryo transfer. So, he said to me that the doctor, when he called, he's like, you have, 6 at this time on ice. He said, how many do you want to implant? I said 2. Let's go for 2. So he picked the top 2 embryos and Mom and I, Mom went with me to that transfer. And I mean, what did you think of it? Did you?
Well, first of all, she was it's very painful. So when she used to fly, she used to hold my hand in the plane and it couldn't feel my hand. I mean, you didn't have a hand left by the time you landed. And that's how I said to her, you want to hold my hand? And she didn't. I was like, oh my God, I said the wrong thing. But it was very interesting because they have everything up on a screen and they show him putting these embryos in. They look like little marbles. They're these tiny round little white things that you see.
It's like caviar.
Yeah, exactly. And, I mean, it was very painful for her. Excuse me. It was very interesting for me. And it doesn't, in all honesty, it really didn't take that long. I'm sure you felt like it was an eternity, but it really didn't take all of that long for him to do the procedure. No. So it was very, very interesting, but very painful. I could see it was very painful for her.
So, it's not beneficial to do, like if you had 5 or 6 viable, it's not beneficial to do all 5 or 6? Or
no, because
if you want quadruplets, if they all,
that's
so you'd have a puppy litter then. You could run into that problem.
You increase the risk of, twins and multiples at that point. I already had that risk. I had the risk of, by inserting 2, each embryo dividing, and then I have 4. You know what I mean? I was lucky enough that, yes, I did get pregnant and found out that both of my embryos stuck. So I had twins, but they were their own. It wasn't, they weren't sharing a placenta. One didn't split. They both stuck and they were growing. So I don't even think, honest to God, I don't think any infertility doctor would allow to insert more than 2 embryos at a time. Yeah. I don't think so, because you're ultimately, God forbid, all of them stick. You're putting your patient at risk. It's not even the babies; it's your patient.
Yeah.
So,
but then you lost one of the embryos. You did lose one.
Yeah. So when you get the positive pregnancy test, you're brought in. You're checking your HCG levels. You want to make sure that they're doubling every 48 hours. And then they'll start doing vaginal ultrasounds because you're starting at the very beginning. Think about this. When most women find out they're pregnant, they're like, 6, 8, 10 weeks along, you're starting at the very beginning. So now you're 4 weeks. You're at the very, very beginning. And I think that's why I felt like I was pregnant for so long, because I felt like it was like never ending. So you're starting the vaginal ultrasounds, and you're literally just seeing like a little sac, just a little tiny dark sac in your uterus. But you go in weekly for these ultrasounds, and each week you see little things that are appearing. Like the following week when I went in, now I'm seeing like the little flicker of the heartbeat, and then the next week they look like tiny little friggin' aliens that are swarming around in my and these things.
Crazy mushroom people.
Yeah. So I had my babies. I was released from my infertility clinic the last time I saw them together, it was 8 weeks. And then I made an appointment with an OBGYN, and they didn't want to see me until I had hit 12 weeks. So they put me on for I think I was a little bit over 12 weeks. So I went in for that appointment, and I, told them it was twins. We went into the exam room so that they could do the ultrasound and check on the baby heartbeat. And one of my babies passed away. He had measured just over 10 weeks. So he had passed a few weeks before that appointment. And that's another thing that's very hard, and I don't think it's talked about enough, is miscarriage. And that was very difficult because I'm trying to mourn the loss of a baby that I fought like hell to get. But at the same time, I still have another baby that's growing in me, and I can't let myself get overwhelmed or over emotional because I don't want to hurt him. Right. I don't want to hurt the baby that's still there. So that was something else that sucked. Like I had to push all those emotions like in the back of my mind for so long. And I couldn't even, and you know what? I don't even think I still have dealt with that, because then it was, I gave birth, and now all of my focus was on my son and, being a first time mom. And I didn't process what had happened during the pregnancy. I definitely didn't. And, once Nico came along, then the pandemic hit. It was like one thing after another. So like I never really got to go back and like
what happens to the embryo inside at 10 weeks? What happens? Did it come in?
No,
what did happen?
No. So your body absorbs it. When it's that early, the body absorbs it. If it was later in the pregnancy, then they would have to go in. Well, it depends. Right. They would have to go in to remove it, or it would come out during delivery.
Yeah.
Okay, so now you're newly married and you want to have more children. So now you have to go through IVF again.
Well, I mean, so listen, right now I work in OBGYN. Can I say my doctor's name that I work with here? I mean, come on, she's amazing.
Hey, you can say where you work.
Hey, what's the word that then she sues you? I don't care.
You can say who your doctor is.
She's amazing. I work with Dr. Quo here at Valley OBGYN. I absolutely adore her. She is amazing. And she and I have sat down and discussed everything, my entire medical history, my background, family background. She's asked about other people in the family with infertility. She thinks I can do this on my own. I mean, she's been going over my labs, having me get blood work frequently so that she can just keep an eye on everything. The only factor that kind of plays a big role here is my age. So I'm nowhere near going into menopause. I don't know. I'm not, like, I have very good ovarian reserve, I think it's called. So I'm making follicles. They're releasing on time. Like I'm doing everything I'm supposed to do. For almost 36 years old, I'm doing great. She really wants me to try and do this on my own. So I'm going to try. But if it doesn't work, because I'm not going to let that much time go by, because again, I'm getting older.
Can't. It's not like you're 21 and you have, a lot of years ahead of you.
Exactly. When I started all this, I was 29. So I was still young, and, I didn't have anything against me. Now I do. So what I'm going to do is I'm going to give it a little bit of time. And then I already know the fertility group upstairs from us. and I've met with the doctor. He's done a couple of tests on me just to make sure, I don't have any fibroids, in my uterus that, hinder me getting pregnant. So I already have a relationship with them, and they already have a game plan for me when I'm ready. So
Okay.
I literally, CVS specialty already has all of my, injectable medications. Like, they're on standby.
So you're ready.
So, yeah.
So would you advise, I mean, with everything that you've been through and would you advise IVF for people that, were in a position where they can't get pregnant and they want to have a child in the worst way and they're not going to go through a surrogate or adopt or whatever, would you advise it?
I absolutely would. Again, I mean, listen, it's a very, it's strenuous. It's emotional. It's really emotional, but it shows you how strong you are. Mm-hmm. You already know that you're strong because you're a woman, yeah. But this it takes it to a whole other level. And I mean, listen, you have to know going into it, you're going to have your ups and you're going to have your downs. It's not all going to be perfect. It's not, because science isn't perfect, but science is giving women a chance when these women are thinking that there is no chance. So I definitely advise it. Go for it. Go speak to your OBGYN first. And then from there, go see an infertility specialist. At least get information. It's scary, but I'm telling you, it's worth it.
Well,
okay.
Two last questions for you. One is, why didn't you just adopt a young Norwegian baby first?
Don't. Olaf?
And all this discussion about eggs, I want an omelet so bad right now.
Oh, God.
But no, honestly, this is a great episode because there are,
there's a lot.
I couldn't even put a figure on how many women deal with infertility issues.
Yeah, I mean,
not just in America, but worldwide, obviously.
It's crazy when you think about it, because like IVF, like obviously when I was younger, I knew nothing about IVF, but I don't remember, when I was younger, hearing a lot about like infertility issues. Like, you just knew, like,
right, it's not something
like
that's
left.
Yeah.
And now, I mean, I have a lot of my patients who come in for their OB care. They come from, they had IUIs or they had IVF. It's such a norm now that, I mean, nobody judges you about it. Nobody would judge you.
Nobody should judge you. I remember you saying, like, asking me, like, does this bother you? And like, no, if somebody really, really wants to have a child and this is an avenue that they can take to have that child, you have to exhaust every opportunity that's there for
No, you're absolutely right. But it wasn't as normal back then as it is now.
No. And at the beginning, a lot of people had a lot of miscarriages until they, really did a lot of the science and stuff like that on everything.
They need to do more research to more so not perfect everything, the art of it, but make it better. Yeah. So, I mean, I would definitely suggest and tell women, if you need the help, go for it.
Well, Kacey, tell everybody if they would like to speak with you or ask you questions or, get your opinion on anything, tell people where they can find you.
So I do have Instagram. You can, find me on Instagram. My Instagram name is Leigh, Leigh 130. You can even, you could shoot me an email if you want. My email is long. Do I have to spell it out?
No, you can give Instagram. How about Facebook? You're on Facebook. What's your Facebook?
Oh, no. What's my Facebook name? I think it's just Kacey Leigh, KaceyLeigh. I think that's it. I don't think I have Facebook
there. Okay.
Yeah, Facebook. Right. Yeah. And if you really want to get in touch with me, just, hound my mom or my brother.
Or, our emails are on the site. You can always get in touch with us.
There you go.
I really appreciate you taking the time today because you're at work and I know your doctor's not there today, but I appreciate it.
Happy birthday, Dr. Quo.
Oh, okay. Happy birthday to her.
Happy birthday.
It was really great for you to come on and, give everybody, the skinny on what goes on and what you went through and what they can expect to go through. And that was really great. So, for all of our fans out there, we're funnyminds.com. So If you have a chance, go on our site. We're changing it. It looks different. We're going to be getting new merch and doing affiliates and what have you, but they're not all up there yet. But there's 2 organizations that we're very proud to be associated with, and that's St. Jude's Children's Hospital and breast cancer. So on the site, you're going to see a big purple button. If you press that button, you can make a donation, which we would highly appreciate if you did that. So to all of our fans out there, thank you for joining us today. And thank you, Kacey, for being on, taking the time to be with us. Yes. See you tomorrow. And yes. So have a good day. And again, thank you. And to everybody,
thank you guys.
Be wise, smile, and laugh, because we all know laughter is the best medicine.
Thank you. Love you.
Love you.
Lumpy out.
Lumpy out.